All right, good afternoon, everyone. I believe we're set up and going live on Facebook as well as here in the Zoom call, and I'm recording this also. So some of you are seeing this in real time or later on Facebook, or you're watching a recording of it. So I think one day I'm going to get savvy enough to get this on Instagram as well. But I'm still figuring it out as I go. Anyway, so this is the weekly Q&A. I'm Jamie Hartman, and welcome to my office. So this is where I work. If you end up deciding you want to work with me as a one-on-one nutrition coaching client, this is a little bit kind of what it looks like. You come into my office virtually, and we meet every week, and we talk about how things are going for you and really personalize the coaching that's provided. Today, I'm obviously answering things generally. Questions were submitted in advance, and I've reviewed them and thought about what I want to say. And I'm answering them not just for the individual person who submitted them, but for all of you to learn from it. So I'm going to I want to show you my disclaimer. So let me share my screen and get that up. To make sure that you see that. I want to, we'll just leave it like, well, let me make it big. I think I can play it. There we go. Okay, so this is my disclaimer, just really important that you know this is general information that I'm providing. I don't diagnose or treat any diseases. This is not a substitute for any medical advice. And if you're thinking about making any significant changes to your diet, starting or stopping a supplement or an exercise program, or of course a medication change, you need to talk to your own medical provider. That's really important, you know that. All right, these are the questions that I'm going to be covering in today's session. First of all, the question came in asking about reintroductions, the best way to test out spices and oils. Another question about reintroduction, if you aren't, it's not an obvious change, talk about that. I had a question, this is a follow-up from last week when we were talking a bit about histamine intolerance. What do I think about natural antihistamines? A question about sourcing organ meats. I get this a lot from my clients. And so I'll talk a little bit about how I help them kind of work through that. And then that last question is a really good coaching sort of question. When you know that you need to do AIP because you have an autoimmune condition and you know that this is a good approach for you to try, but have difficulty sticking with it for more than, well, however long. This person said a week, but it's frequent for this to be a challenge for people. So any tips on that? So I'll talk about that. I'm going to bring my face back here big so that you can see me and start to talk about those questions. So the first question that came up was about the best way to test out spices and oils in reintroduction. And that's a great question because, we see those, the directions that you'll see online or that a practitioner will give you, and that'll say, consume a teaspoon of something or a full serving. And you're like, I would never eat a teaspoon of black pepper, for example. So the simplest, most elegant way I have figured out how to handle those things that are never a food you'd eat on your own, but always like a seasoning or a cooking oil, something that would be like a flavoring, an ingredient, is to actually prepare a dish with a normal quantity of that particular item in it. So if you normally would take like say a chicken breast and sprinkle a little bit of pepper on it, do that. Whatever would be like your comfort level of how much pepper, if that was the example you were using, you would ever consume in a serving. Take that chicken breast, sprinkle the pepper on it. And then as you look at the directions that you've been given that say to eat a small bite, eat a larger bite, eat a full serving, just treat that seasoned chicken breast as your reintroduction. Assuming that, there's nothing else in that dish, that chicken breast or whatever it is you decided to do that is unusual for you, there are all things that are AIP and that you tolerate and you tolerate, it'll be a very good test. There'd be no point in taking a whole teaspoon of pepper to find out you can't consume a teaspoon of pepper because you're never going to do that. So the general rule of thumb is to always try to reintroduce foods in a way that's mimicking the way that you would actually eat them. So the same thing goes with oils, whatever would be the natural quantity in a salad or whatever. The other question about reintroduction had to do with the idea of like, what do you do about when you feel like maybe there's a slight reaction? Probably more accurate, it's like when you don't really know. It's really easy to tell if a food really bothers you and you're like clearly I should never have this food again. You know, when you get the really obvious symptoms, they're no fun to have, of course. Nobody's excited about a food, you know, making them feel really miserable, but at least it's a clear indication. You guys see my dog coming in here in the corner, but it's real life here. I'm truly live. Hopefully she'll be quiet. She's settled down. So when you have those sort of questions, you know, and you get a sense, at least some indication that a food is probably not good for you. And it's not always clear because there's always other variables in your life. You know, if you eat a food and then within the next 24 hours, you don't feel 100% fantastic, is it because of that food that you reintroduced, or because something else is going on in your life? And maybe you notice that's a pattern. The next time you have that food, you see the same thing happens. And then the next time it happens again. And now you're starting to indicate, you know, should I never eat this food because it's giving me this low grade reaction, this low grade symptom? This is where it becomes a judgment call. And there's not a single right answer. I can tell you that I think all of my clients I've ever worked with through reintroductions have had some experience with this. You know, it's true that they will test foods and find out they're fine. They feel great when they eat them, no problems. And most people will find some foods that trigger something for them and they can't eat them. But there's a whole lot in between that people wonder about, they question. And so it becomes for many people an ongoing process of eating the food, seeing how you feel, starting to question, you know, if you notice a pattern, if you're eating it pretty frequently and you think, you know, I wonder if that thing that I've been noticing is due to the food that I had, you know, been testing and had an inclination might not be great for me. You just run another experiment. You just eliminate that food again. So you say, okay, I'm going to not eat that for the next week or two, see how I do, and then go from there. You know, if let's say you had that food that you're wondering about and you cut it out for a couple of weeks and you start just feeling great and you're so happy with how you're feeling, that might just be the end of it. You just decide, you know what, I didn't need that food in my life anyway, whatever food we're talking about here. Or maybe it was a food you really do want in your life because you really like it, you really enjoy it, and you want to get a clear answer. You can just run another experiment. You can repeat reintroductions. Reintroductions are just controlled experiments. Where you're just controlling as many variables as you can, identifying a food that you want to see how your body responds to, and then running that experiment. And the things that you will learn over time will change. You know, I mean, I've been doing this long enough for myself personally that I can tell you that there have been times in my life when certain foods seem to work worse and better than other times for me, you know, and that there are some foods that I've now recognized, you know, I can eat maybe once or twice a week and I feel completely fine. But if I start eating that particular food every single day, I will start to notice some aches, some pains, maybe some loss of my, you know, quality of my digestion. I'm getting a lot more every day, every year, more in touch with my body and how it works, and you will too. So it's not like there's one right way to do this, you know, where you're going to have the definitive answers. It's challenging to get that as your, you know, mission, that you're going to have to keep testing foods forever. But it is true, you know, your body, all the cells in your body are turning over, and at different times of your life, you're going to have different needs. And so being mindful of all of the foods that are potential problems, that's one of the best kind of things I can say for AIP, is that it gets you to a baseline that's a really nutrient dense, if you do it right, a really nutrient dense, high quality diet. And it should help you to start feeling really good. Again, if you're doing it right, if you're adding in a lot of the nutrient-dense superfoods. And then that gives you a base, a foundation upon which you can expand your diet, and you can test and see how well you handle certain foods that you now know there's nothing inherently bad about that food, but that as a person who lives with an autoimmune condition, or some kind of symptoms relating to an autoimmune disease, if we're talking about AIP, that you might know that those foods may not always work for you. And so it helps to have that knowledge so you know where to start, you know, which foods should I wonder about? Which foods should I start with if I start to not feel good and I want to test them? So it's a lifelong process. A lot of times people will wonder, like, well, wouldn't it just be better to just stay in the elimination phase then? And my answer to that is no, it actually wouldn't be better. The elimination phase is fine. If you have to stay there, you can make that a very nutrient dense way of eating. And you can even learn all of the tricks and you know, things that will help make it sustainable, so you can, you know, eat enjoyable food and it's delicious and you can, you know, socialize and all of those things. But it is restrictive, and it does eliminate foods that actually do provide a lot of nutritional value if they don't also cause problems for you. So I think, you know, we think about some of the foods like nuts and seeds, you know, those actually are pretty packed with nutrients and can be super, you know, healthy parts of healthy diets for people who are not having reactions to those foods. So if you can get to a point where you can add those back in and do well with them and figure out, you know, a personal tolerance level, and if you can identify any particular ones that don't work for you and then avoid those, your overall diet is going to be more varied, have more opportunities for nutrition, and be very worth, you know, identifying that. So that's just one example. I mean, all of the eliminated foods that are not junk food, you know, all of those high quality that are in the reintroduction stages are going to have some benefit for some people if they are able to tolerate them. So I don't know if I've talked about that in previous weeks, but it is really something that I'm pretty passionate about, that doing reintroductions is something you should do. You want to learn your body. You don't want to live your life in fear. You don't want to live your life assuming that you can't eat a food that actually would probably be perfectly fine for you. You want to have that information. It's also helpful too to do reintroductions and to find out if you do have any of those big dramatic reaction foods, so that you know if you're in a situation where you don't have complete control of your food, that they need to be priorities for you. You know, if you know that when you eat, you know, whatever fill in the blank food, that you're going to have a reaction that's going to, you know, give you pain, that's going to keep you from being able to enjoy your life, you want to know that so that you can really prioritize avoiding that food. So knowledge is important. It's very helpful. And that's what the reintroduction process does for you. That gets beyond the spirit of that question that came in, but I think it's always good to talk about that. Let me take a quick look at my notes. Okay. The next question was talking about natural antihistamines for people with autoimmune disease. So the natural antihistamines that you'll hear about, there's a huge list of herbs and compounds and probiotics, you know, bacteria that may help with the histamine response. None of them actually, you know, work like a Benadryl does, where it would be a rescue remedy. So this is important for me to preface this. If you deal with an allergy that could potentially be life-threatening, clearly there's no herbal remedy, you know, to reverse that. If you need an EpiPen, or if you need even Benadryl, that's what you need to take. So these are not in any way to suggest that they're going to help you in a crisis. They have some potential prophylactic benefit, so they may be helpful for you to prevent the dramatic histamine response somebody might get if, like, say, you know, your histamine cup is overflowing because it's seasonal allergy season, and maybe you're also consuming some food that you're reacting to and some high histamine containing foods, and that you just kind of get that bubbling over and you're feeling really uncomfortable. These are not going to reverse that, but they might prevent that from ever happening. So one of the big ones that people will talk about is, I hear it pronounced all kinds of ways, but it starts with a Q, letter Q, quercetin or quercetin or quercetin, I don't know. Anyway, you probably know what I'm talking about. And if not, I'll put it in the comments of the recording when I post this on YouTube. But that is the one that probably has the most actual evidence, both, you know, kind of in experience, like what practitioners see with their actual patients and clients, and also has had some animal studies and some human studies that show that it might be as effective as some of the prophylactic, again, antihistamine medications. So this is, again, not going to work like, Benadryl would in an allergy attack and like stop that. It would be something you would have to take, all the time or during the allergy season to help lower that response that you get. And it doesn't change the amount of histamine that your body would release. What it does is it blocks the effect to some degree of that substance. So quercetin is one good example of one. There's also some evidence that vitamin C can have some benefit, and there's not much of a downside to taking a vitamin C supplement if you want to give that a try. Dosage amounts should be personalized to you. So this is a good case for, talking with somebody like myself, who works with you and knows with you personally about how much you should take. If you take too much vitamin C, it's not like it's not one of those substances that we get really worried about. You can't really have a toxicity to it, but you can have diarrhea if you have too much vitamin C. And so it's helpful to have some idea of how much you want to start with so you don't get that. Another way to naturally help your body deal with histamine is to consider some bacteria, beneficial bacteria, so probiotics. And this is kind of tricky because some of them will also, depending on your sensitivity level, might actually make you feel worse if you don't get the right combination. There are a few that, kind of come up most often in the research. They are some of the bifidobacteria family, Bifidobacteria longum, has been shown to actually suppress allergic reaction in rats, and also Bifidobacterium infantis. So this is often included in probiotic blends that have effectively reduced histamine in human subjects. So those are a couple other things to consider. So, this is how, when I work with clients, we kind of go through all these things. There's no one thing that works for everybody. Quercetin, the first one I mentioned, is is found in food and in pretty high concentrations in apples and in onions, which are both really high in FODMAPs. So a lot of times I'm working with people with digestive problems, and those healthy foods, they give them digestive issues, and so they're not eating a lot of them. There's other foods that quercetin can be found in, but sometimes, we do want to look at the food sources of these things, but they're not always an option for everybody. So taking a quercetin supplement can be really helpful. Another one that people will often talk about, or that people will come to me already taking because somebody else recommended or they read about it somewhere, is a curcumin supplement. And curcumin is the active compound in turmeric, the spice. And that is one that has some pretty weak, actually, evidence that it could be helpful for histamine intolerance, maybe more anecdotal than anything. Sometimes people are taking it primarily just because they have an autoimmune disease or they have an inflammatory condition, and it has some anti-inflammatory properties, or it might help their immune system. And, it is very, very powerful. Curcumin, turmeric, has some pretty powerful effects. But I do also want people to be cautious of that. If you're taking one of those supplements, remember that we have this tendency to think it's either going to be good for me or neutral. It must be just, either going to have this incredible positive effect or not help at all. And, what do you have to lose? No harm, because it's natural. And that is, overall, for these that I'm talking about, yeah, that's true. They're not going to cause significant damage to you. But curcumin is a good example of something that if you've been taking it for a long time and are still experiencing a lot of inflammation or a lot of immune activity, so like say your autoimmune disease is flaring despite you taking curcumin, it might be a good idea to stop taking it. That's usually the first thing that I suggest when I work with a client who's come to me and their symptoms are not under control, they're not feeling good, and they're already taking a curcumin supplement. I have them do a trial of not taking it for a while and see if that changes anything. And the reason for that is because it is interacting with the immune system in a particular way that might be helpful for you, or it may be counterproductive. The immune system is really complicated. It's not simply an on or off or high or low switch. It has many different components to it. And so if that particular supplement, whether we're talking about curcumin or quercetin or even the probiotics, is having the effect of modulating that that action of your immune system, it could be throwing off a balance somewhere else, just to oversimplify that. Thinking about balancing, you know, all these different actions, it might be a wise thing to consider to take a break from any of those supplements that you have taken in the past and see if things, you know, change. So it's kind of similar to food introductions and eliminations. You know, you have to run some of these experiments and talk to your doctor. Another thing I should also mention, anytime we're talking about supplements, it's really important that you consider any medications that you're taking along with them and check with your pharmacist. That's usually the best person for that, and make sure that they've just cleared whether there are any potential interactions between prescription medications and herbal remedies or high potency supplements. I mean, generally speaking, you can take like a multivitamin, you could take that vitamin C that I mentioned, not going to have any big problems there or even mild problems with that. But once we get into taking some herbal remedies, things that really purport to be very powerful, have a powerful impact, it's a good idea to check with somebody who knows the whole picture about whether there's anything to be aware of. So pharmacists are a great resource for that. Okay, I'm gonna again check my notes, make sure I'm getting all these questions covered. Okay. The next question is about sourcing organ meats like liver. And the question was asked, is it necessary to get organic liver or grass-fed liver? How picky should I be about this when I've, realized that, the benefits of having organ meats and I want to add them into my diet? Do I need to go to the ends of the earth to try to find the organic, the highest quality, the grass-fed versions of these foods? And, part of my answer is that it might be worth it if you can get it. Like if it's a matter of it just costs a little bit more and you can afford it in your budget, get the best quality you can get. And again, I qualified that with if it fits in your budget. I'm not suggesting that you must do this in order, just to be healthy, you have to go break your budget. But if it's available, if you go to the store and you're sitting right there looking at it and it's like right there, here's the organic option, here's the regular option, and you could afford the organic option, that's what you should get. But if you can't afford the organic option, or if it's not available, because a lot of times it isn't, all you got is what the grocery store stocks, or the farmer that you used to get it from doesn't have it anymore. This is really common because the word is getting out that more people are realizing the benefits of these organs that they for a long time thought were just gross and didn't want to eat. It may be trickier to get them, and you might kind of go back to the grocery store and be like, well, I wonder about that beef liver that I see in the freezer section. Is that okay? Like it's just regular beef liver. Like there is no qualification, no extra like claim on the label about it being anything special. Is it okay for me to eat it? And my answer to that is this: any organ meat consumption is better than no organ meat consumption. Okay? So if your choices were between having that liver that you found in the grocery store in just the regular section, regular old grocery store liver, versus not having any at all, clearly I want you to go ahead and get what you can get. And especially when we're talking about liver, because contrary to sort of our common knowledge, our common perception of what the liver does in an animal, we hear that it filters toxins, which then you would think, oh my gosh, it must be loaded with toxins if that's what its function is. So I certainly shouldn't be eating the liver from an animal that was raised non-organically, like not in the best of practices, But the reality is that's not really what a liver does in your body or in their body. The liver doesn't filter. It's not like a sponge that gets dirty and the toxins stay there. What it does is it cleans and it processes. Think of it more like a water treatment plant. So the liver is the master organ for helping your body detoxify. It does that in your body and in any mammal's body or any other animal that has a liver's body. it allows their whole body to manage that toxic load, whatever toxins we're talking about, and clear them out. So as long as the animal is overall healthy, the liver is going to be healthy as well and have all the same nutrients, regardless of whether that animal was raised in the organic system, on a farm, following better grass-fed, or pasture-raised practices, or in the regular conventional meat system. Now, of course, you may have other kind of criteria for what you prefer to purchase. I certainly do. I do try to, kind of support with my pocketbook. My vote is my pocketbook. Support the practices of farming that I believe in. So I do try to buy liver and other organ meats from local farmers that I feel confident in, that are doing good work and that are treating their animals well and that are, raising them in a way that's helpful, helpful rather than harmful for the environment. But I also know that when it comes to just my own nutrition, if that isn't an option, I'm going to go to the grocery store and I'm going to just buy the liver that I find there. What I have discovered where I live anyway is that I can get regular beef liver most of the time in my well-stocked, larger grocery store. I do live in an urban area that has a large, quite a diverse population. But I have found that it's often stocked in the kind of, it's still in the meat section, but it's like off to the side by the, for lack of a better word, the ethnic meats, the things that the regular grocery store consumer, the run-of-the-mill grocery store consumer is not necessarily looking for. So it's sort of a hodgepodge kind of section. There'll be really fancy kind of, duck confit in the same section as innards, that might appeal to a variety of different, specialty populations. So if that's what you can get, that's what you can get. It's better. It's always better to have organ meat rather than no organ meat. So the last question, because I went on a little bit too long here, was talking about sticking with AIP. And I'll just end this last couple of minutes just talking about some of these things. So, I think one of the things to unpack here is the beating yourself up part of it. So the person who submitted this question said, I seem to be able to do it, and I last for like a week, and then I fall off the wagon and I beat myself up for it. And I'm imagining this person didn't say this in their question, but then that kind of spirals into some shame and some disgust with yourself and feeling like you failed. And that's not helpful at all for your health. So anything you can do to avoid that is important to try to do. Be kind to yourself. Treat yourself like someone you love. Imagine that instead of it being you, you're supporting someone in your charge. If you're a parent, you can imagine you're helping your child. If you're not a parent, we can empathize. We can understand what it's like to have somebody younger and more vulnerable than us who's trying to do something hard. And what would we say to them to encourage them, and try to say some of those same things to yourself. And I think probably one of the first things you would say would be like, it's okay. We all make mistakes and we can all try again. So I think that the big thing to remember is that while being AIP compliant is helpful, it's not like there's no gold stars given for it. It's not a morally superior way to be. If you're not perfect at it, you're still getting some benefit and you can aim towards perfection. So if I only had to give one piece of advice, I would say, instead of falling off the wagon, let yourself slip and just slip less often. Let it be a process. Start your AIP elimination phase. If you've done it before, you know what it's like. Start it. Maybe you want to ease into it instead of doing it all at once. Or maybe you ease into your expectation. So you say, this week, my goal is to be 100% compliant at least 50% of the time. You could break that out however you want it. It could be certain meals, certain days, so that when you do have something that doesn't quite go according to the way you'd like to be, it doesn't feel like it's completely falling off the wagon. And instead, it was part of the plan all along. So that's one approach you might take. So I'll talk more next week about some more of my kind of tricks and tips and things I've seen work for people as far as making that transition to AIP actually really, really work for them. But I'm going to leave that there because this is already 30 minutes long and I probably lost most of you at the beginning. But if you listened all the way to the end, I thank you. Thank you for your attention. Again, I'm Jamie Hartman, and I am happy to answer your questions. Please submit them. If you have any additional questions, I'll put the link in the comments where I post this on Facebook and on YouTube, so you know where to go if you want to have your question answered. You can submit that. I do ask the questions in advance. It makes it a lot easier for me to organize it rather than trying to look at comments and get them live. So I appreciate people doing that. All right, until next week, take care, everyone. Thank you.